two leading health publications say the status quo on Christmas is untenable.
I would encourage the government to look at their rules over Christmas. I'm not sure you got it right. In fact, I'm sure you haven't got it right.
We and the Scottish Government do intend to strengthen the guidance we give to people about whether and how they should make use of the flexibility.
The advice of the Welsh Government is that only two households should come together.
Is Christmas cancelled, Prime Minister?
And it's now likely that the next big mistake will be over the easing of restrictions over Christmas.
Mr. Speaker, I wish he'd have the guts just to say what he really wants to do, which is to cancel the plans people have made and cancel Christmas. I think that's what he's driving at, Mr. Speaker.
Given the early evidence we have on this new variant of the virus, I must tell you we cannot continue with Christmas as planned. We will introduce new restrictions in the most affected areas, so we're asking everyone in all tiers to stay local. People should carefully consider whether they need to travel abroad, and they should follow the rules in their tier.
The new variant is out of control and we need to bring it under control.
Several countries are responding to the new variant of the virus by suspending travel from the UK.
It was the Dutch who acted first.
Ireland, Italy, Belgium, Germany, Canada, Turkey and Hong Kong.
Including France, which is barring arrivals by air, sea, rail or road, including freight.
Hundreds of trucks were stranded on either side of the channel. Visible chaos spawned from the invisible virus and its new variant.
The United Kingdom is the first European state to record more than 100,000 deaths linked to the pandemic. And according to the University of Oxford, the UK has one of the highest COVID death rates anywhere in the world. Prime Minister Boris Johnson, whose handling of the pandemic has been heavily criticised in some quarters, said he was deeply sorry for every life lost and that he took full responsibility for everything that the government has done.
The pandemic's absorbed almost all the government's time and focus. But whether on adequate equipment, testing or lockdown itself, ministers have been accused again and again of being too slow at the start.
Prime Minister, near the start, the hope in government was to contain the numbers to 20,000. It's now 5 times that. What went so wrong?
I am deeply sorry for every life that has been lost, and of course, as Prime Minister, I take full responsibility for everything that the government has done. What I can tell you is that we truly did everything we could and continue to do everything that we can.
Well, since the beginning of the pandemic, almost 250,000 people in the UK have been admitted to hospital with COVID. More than 37,000 are in hospital at the moment.
Two daughters who lost their fathers in COVID-hit care homes at the start of the pandemic are now suing the government. It's a landmark action, not just in terms of a failure to protect the vulnerable, but responsibility for aggravating the risk.
I do not want anyone else to go through what we have been through as a family. I feel terrible guilt. I feel as though he was locked in to die.
Matt Hancock's protective ring statement was a lie. The defendants have provided no evidence of measures to put a protective ring around care homes.
In just 3 months, from March to June last year, some thousands of people living in care homes died from the virus in England and Wales, with some official reports blaming slow, inconsistent, reckless and appalling government policies for the huge death toll. This week's case against the Department for Health and Social Care wants it held to account. The failures surrounding care homes are one of the biggest scandals of the pandemic, from mass discharge of elderly patients from hospitals to care homes without testing or isolation. And who can forget when the government said that care homes wouldn't be affected at the beginning of the pandemic? Of course, we now know that they were the worst affected.
Earlier this year, and until 12th of March, the government's own official advice was, and I'm quoting from it, "It remains very unlikely that people receiving care in a care home will become infected."
It wasn't true that the advice said that.
Well, government guidance published on the 25th of February of 2020 said twice it was very unlikely people receiving care in care homes will be infected. This advice was withdrawn on the 13th of March. A few months later, Boris Johnson tried to shift the blame, saying it was care homes that didn't follow the rules.
Many didn't really follow the procedures in the way that they could have.
So while this week's case is ultimately about two families' search for justice, it runs far deeper, alleging a string of government blunders.
Too many people
believe that this pandemic is now over. I personally feel there are some hard months to come in the winter, and it is not over. Deaths are increasing.
Case numbers are skyrocketing, prompting fresh questions about what the country should do next. So far, the government has resisted calls for contingency measures, such as reintroducing mask mandates and vaccine passports, despite health services saying they are already at the edge.
Every health service leader I speak to says that they are right at the edge. We know that things are almost inevitably going to get worse, and the question is simply this: do we accept some inconveniences, the inconveniences of Plan B, and do we recognise that as a nation we need to get behind our health and care system over the next months? Or do we somehow cross our fingers and hope that the almost inevitable doesn't happen and stumble into a crisis?
France 24's Doug Herbert's been keeping a close eye on the situation there in the UK. He joins me now on the set. Doug, why is this situation getting worse day by day?
Two major reasons. One, complacency. And the second, misguided and wrong-headed political messaging from the Boris Johnson government. His government, since on so-called Freedom Day in England in July 19th, they lifted nearly all the restrictions. Since then, it's been a free-for-all in Britain, basically, when it comes to the pandemic. And the political message, if it hasn't been explicitly put in these words, has been, pandemic's over. You know, keep on, carry on with your business. Life is essentially back to normal. And a lot of Britons have sort of responded to that messaging. You know, you go around places in London and beyond, and, you know, pubs are packed. People aren't wearing masks indoors. Unlike a lot of other European countries, including, you know, from Germany to France to Italy to Spain, where the case right now, if we can even bring up the numbers, are more than all those countries combined, the new cases in Britain. Unlike all those countries, there was never a mask mandate for indoors. There's no limits on capacities for cinemas or theaters, no real social distancing to speak of. You could see there almost 50,000 cases. That was on Wednesday, Jeannie. We also, this week on Monday, had about 50,000 cases. Now look, daily deaths, 179. You know, any deaths are too much, you could say, with COVID. But thankfully, because of the vaccines, this could have been far more catastrophic. The fact that what Britain's saving grace here has been that it has had vaccines. You'll remember early on it was a trailblazer, excuse me, in rolling out those vaccines. It had a very, very quick start. It was the lead of the pack practically in the world early on, but it's fallen behind again. But because of the vaccines, those deaths, hospitalizations are way down from what they were, say, a year ago when the case numbers were about the same. 73%, almost 3/4 of the population or more, have gotten their first dose. 70% have gotten a second dose. That's obviously helping. It's the new stages now of the vaccines that are proving more tricky for this government because they had success early on. They got a lot of people vaccinated very quickly. That was months ago. Now they're on the booster shot phase, and they're not having as quick an uptake, to put it mildly, whether you're talking about teenagers or the over 80 unvaccinated so far. So the government's calling on them to step forward and get their vaccines. But it boils down to bad messaging, not following the scientific guidance, and even now not really following the pleas, the imploring of doctors and scientists to lay on more restrictions.
The Royal Preston Hospital, under pressure again from COVID. In the last 3 days, the number of patients here with the virus has almost doubled to 60, and despite the vaccine, no one here is safe. This is why we're being told to get vaccinated. There were nearly 50,000 cases recorded today, up 17% in a week. Hospital admissions are also up 11%, and there were 179 deaths, up 21%. The time for restrictions, some say, is now.
Let's recognise what's likely to happen. Let's mobilise the government and the public to try to reduce the risk, reduce the spread, rather than stumbling into a crisis.
The government hopes booster jabs and 2 new antiviral drugs will avoid the need for more restrictions this winter, but it's a gamble few want to take.